On behalf of California's veterans who have served their country so ably and admirably in a time of need, SJR 23 urges the U.S. Departments of Defense and Health and Human Services to resolve the current disconnect between the Federal Centers for Medicare and Medicaid Services, also referred to as CMS, and TRICARE, the health care program administered by the United States Department of Defense military health system, which provides comprehensive health coverage to approximately 9.4 million uniformed service members and their families around the world. Of those 9.4 million TRICARE beneficiaries, approximately 1 in 10 are also concurrently receiving Medicaid coverage. Under existing federal statutes, when an individual is covered by both TRICARE and Medicaid, TRICARE is considered the primary payer and Medicaid the payer of last resort. Prior to the beginning of last year, TRICARE had an agreement with CMS to share and cross-match data in order to coordinate benefits for those beneficiaries covered by both providers. This coordination of benefits was governed by a memorandum of understanding, which has since expired, and the two agencies have so far been able to reestablish terms for the continuation of this important program. That failure to reestablish a data matching agreement has placed a substantial fiscal burden on the state of California. Annually, it shifts approximately 18 to 21 million in costs from the federal government to the state for unrecovered claims that should have been paid by TRICARE. Additionally, TRICARE policies prohibit Medicaid from billing a claim that should be TRICARE's responsibility if that service was rendered more than 1 year prior. On average, this limitation on filing shifts at least an additional $70 million in cost to the states. Out of TRICARE's total of 9.4 million beneficiaries nationally, roughly 8.6%, or approximately 800,000 uniformed service members and their families, are located here in the state of California. As a consequence, our state will continue to incur a burden on the order of $6 million or more in additional annual costs if the issue of data sharing between TRICARE and CMS is not resolved soon. In recognition of that inequity, SJR 23 further urges TRICARE to waive the 1 year timely filing restriction for all claims currently backlogged as a result of the current breakdown in federal coordination. The cumulative impact of cost shifting caused by the disconnect between TRICARE and CMS is both an unjustifiable burden on California's already strained healthcare resources and a breach of the federal government's obligations to our veterans. For those reasons, I respectfully ask you to join me in voting aye for SJR 23.